Ergonomics is very, very important, and how you scan the area is important. I asked a question today, how many people have attended hands-on, and a lot of people had. So I will anyway take you through the scanning part as well. For scanning, whether it's a supraclavicular or interscalene, so that is the blocks, brachial plexus block above the clavicle, it's important that patient is in a reclined position. Um, if it is a left side one, you can actually have your scanner on the other side, or you can have the same side as well. It's not uh, depends on how you are actually going to approach the plexus, and it changes. uh, I always find being right-handed, I always find easier to do left-sided blocks. Uh, and the on the right side, most surgeries are done on the right side. You need to have a little bit of, be innovative at times with the way you put the probe and the needle. And I will likely show you how we do it. So we talk about the, like I said, interscaling. Some people do it. They go from your cricoid cartilage from the midline, then just keep moving the probe laterally from there. You identify the blood vessels, go more laterally, and look for the interscaling area. That's what we did. But we teach a different three-step method in scanning. So we start off with the supraclavicular area. The probe is angled as if it is looking into the nerves, almost 45 degrees at that area. So you will see the blood vessels, you will see the clavicle, and you will see the branches of the brachial plexus. In the second step, all you need to do is straighten the probe. So you tilt it down so that it's almost perpendicular to the neck, and then slide it slowly, trying to recognize, from the branches. You would actually see the upper trunk, middle trunk, lower trunk, and then go up slightly, and you'll see your roots in this interscaling groove. So we'll look at some of these videos. So we'll start off with that. So here you can see the artery pulsating, and that is my lateral side. That's the medial side. So on the right side, the medial side, left side. And you can see the brachial plexus, the branches. So people call it as a bunch of grapes there. Okay, so we are there now. So this is as if we're looking. Now that is the rib. There is the pleura there. So there's echobright. Your scalenus medius is here. Scalenus anterior is there. Sometimes in some of the patients, the scalenus anterior can be very, very small. It can be very thin, and you would actually see the blood vessels. Okay. Uh, so that was the suprascapular. Sorry, the yes, supraclavicular area. And we now actually start, like I said, we have straightened the probe, and we are looking towards the area where you would actually see formation of the superior trunk. The middle trunk is the continuous C7 and C81 forming the lower trunk. So you've gone from there, and then we move on to try to look for, so you can actually see the formation trunk. And there, can you see there was a blood vessel going up there? Okay. So that is transverse cervical artery, because it's higher up. Lower down you see dorsoscapular artery, but this is transverse scapular artery. So that is the interscalene area. That is actually a nerve root. This is not part of the interscalene. So we have gone a bit higher, but we will actually come down. So once we've done that, we again start scanning down. You see a nerve root. You can see the spinous process C4. We come down. Okay. And that is the interscalene area now, interscalene area. Okay. And we go further down, and that's formation of the upper trunk. That is where you do the upper trunk block. Okay. Okay. So upper trunk. Okay. and again go down, and then once you start seeing the artery, um, then you actually tilt the probe and you will see the divisions across. There you go. So that is a supraclavicular scan. Okay. So ultrasound glove block is not only about scanning and knowing where to put a block, but it's also how you position your probe, how you position your patient, how you insert the needle. Okay. So probe, like always, like said, however you are like looking